Hello, welcome to my channel, the PBM and Tinnitus Lab. I'm Dr. Katoyun Montazeri, and in this video, I'm going to talk about somatic tinnitus and its definition and causes, and also the potentials of PBM or photobiomodulation in treatment of it. This is the 12th session of the PBM and Tinnitus series. First, let's take a look at a case of somatic tinnitus. Charmin, a 36-year-old woman who presented in audiology clinic because of a continuous high-pitched tinnitus in her left ear since 14 months ago. She has fluctuated tinnitus intensity peaking in the morning upon awakening. She didn't have a history of sudden hearing loss or vertigo, but she had the history of jaw tightness and occasional dull temporal headaches. And also she has clenching teeth or yawning and also clenching her teeth or yawning made the ringing louder and sharper. In a physical examination, she has normal otoscopic examination, means that her eardrum and external auditory ear were normal, and but she has tenderness in palpation of the masticatory muscles, and also she has myofascial trigger points. Trigger points are hypersensitive and hyperirritative points that are in skeletal muscles, and they are very tender, and compressing them leads to referral pain in the other parts. So she has myofascial. She had myofascial fascial trigger points, and the audiometric tests, including pure tone audiometry, and also speech discrimination scores were within normal limits, but in somatic tests, she had increasing the loudness of her tinnitus in jaw protrusion test, and also the pitch of tinnitus was changed in forceful neck flexion, and also the volume of tinnitus was increased by manual pressure on the temporomandibular joint or TMJ. So the diagnosis was somatic tinnitus, or also called as somewhere in as somatosensory tinnitus, secondary to temporomandibular joint disorder or TMD. The management for her managements were included orophacial physiotherapy focused on intraoral release of mastication muscles, and also fitting a night guard to manage bruxism or teeth grinding, and also PBM therapy. I published 12 full videos about the effects and mechanisms of PBM in the PBM Masterclass playlist, and you can watch the full videos. PBM has the ability to reduce inflammation in the TM joint and its surrounding neural pathway. And the outcome was 60% reduction in annoyance and morning loudness of tinnitus after 6 months. So she was satisfied of therapy. But what is a somatic tinnitus? When we call tinnitus as a somatic type, when the perception of tinnitus sound or its pitch or loudness is modulated by sensory and motor inputs from the head and neck and jaw, or when the perception of sound is changed by some movement in a head and neck or palpitation of some areas, we called that it is a somatic tinnitus. So somatic tinnitus is changed through physical maneuvers, jaw clenching or neck rotation and pressure on trigger points, and also eye movements, gaze evoked tinnitus, and changes in posture. But why somatosensory inputs can trigger or develop or induce tinnitus? This is because of a tiny nucleus in the brainstem called as dorsal cochlear nucleus. I mentioned the DCN or dorsal cochlear nucleus in the TMJ videos. I published 2 videos about the effects of TM joint dysfunction on tinnitus. So dorsal cochlear nucleus is the first station that receives auditory information from the cochlea, and it also receives somatosensory input from the fifth cranial nerve and the cervical spinal nerves C1, C2, and C3. This is the dorsal cochlear nucleus. It is in a brainstem, and the auditory signals and also the somatosensory inputs from the head and neck and the cervical spine C1 to C3 integrates in this nucleus. You can see here the signals are integrated in this nucleus. There is a disinhibition theory to explain what is happening in somatic tinnitus. In normal conditions, the somatosensory inputs are subtle, but in hearing loss or somatosensory insult, for example, an issue in head and neck, the DCN undergoes maladaptive plasticity and the somatosensory fibers become hyperactive, leading the DCN neurons to fire excessively. And the brain interprets this extra neural activity as sound, resulting in tinnitus. So it creates a kind of phantom perception or tinnitus. In my own study published in a PLOS ONE journal in 2024, I examined the effects of photobiomodulation in the treatment of tinnitus in rat animal model, and we investigated 3 parts of brain. One of them was a dorsal cochlear nucleus to investigate the outcome and the effects of PBM. And you can see here, this is the picture, the results of immunohistochemistry tests. We assess the double cortin protein as the neuromarker of plasticity and neuromarker of tinnitus. You can see in the control group, the expression of double cortin was significantly less than the tinnitus group. We created tinnitus, induced tinnitus in rat animal model by injection of sodium salicylate, and in tinnitus group you can see the expression of the neuromarker of plasticity, which was the double cortin protein, was significantly higher than the control group. So it indicated the involvement of dorsal cochlear nucleus in tinnitus and its plastic changes in tinnitus. The common causes of somatic tinnitus are TM joint disorders, teeth grinding or bruxism or misalignment, and cervical spine dysfunctions, whiplash injuries, and neck muscle tensions and disc herniation. Also, myofascial trigger points and post-traumatic stress caused by injury to the head or neck. But what is the clinical importance of somatic tinnitus? The discovery of somatic tinnitus is crucial because it offers a different therapeutic pathway, and it often responds to physical therapy, stretching and strengthening the cervical muscles, and also TM joint treatments using dental splints or guards and or jaw exercises, and also photobiomodulation, because it can reduce the inflammation in trigger points, and it can modulate neural activity. Most of the patients respond to the treatment better than the otological tinnitus. Its treatment is easier in compared to the otological tinnitus. These are the references, about the diagnostic criteria and the treatments of somatic tinnitus, and also the review about the pathophysiology and diagnosis and treatments of somatic tinnitus, and also the effects of PBM for somatic tinnitus. Thanks for your attention. If the video was useful for you, please subscribe the channel and suggest it to the other people. For the next video, I will talk about one of the very important kinds of tinnitus, reactive tinnitus. So thanks for joining me, and stay tuned.